A few months ago, Parkridge announced their intentions to build a new freestanding emergency room in Cleveland. However, they faced opposition from Vitruvian Health, who owns the only emergency room in Cleveland, the Bradley Medical Center.
Today, they faced off in front of the Tennessee Health Facilities Commission to decide if that would be built. News 12's Nick Hill has numerous community centers spoke about various issues. Nick.
Andrew K., every hospital that opens in the state of Tennessee must obtain a certificate of need, certifying that their operations will help the community and existing health providers they plan to open in. Parkridge says that their new freestanding ER plans to do just that, while Vitruvian says it threatens their ability to provide rural health care. However, several community members say that this is a needed addition to the Cleveland community.
My husband almost bled to death waiting for care at the only ER that Bradley County has. We waited 6 hours in the waiting room and never got to triage.
The dozen Bradley and Polk County residents who showed up to speak in favor of the Parkridge ER say that with the population group of Cleveland and surrounding areas, the one lone emergency room at Bradley Medical Center is no longer enough to support the demand.
After waiting for some time, I was told it could be up to 5 more hours before I would even be seen. At that point, I didn't feel like I could wait any longer.
So I wrote back, why are they going to Chattanooga? And she said, he told me because the machine that they need is broken today.
In comparison, only 2 residents showed up to show support for Vitruvian against Parkridge, citing their concerns over cost and the lack of supportive care in the Cleveland area.
A new standalone ER won't close that gap. It treats crises after they occur, but does nothing for prevention. Bridging this divide demands ongoing preventive and primary care.
Parkridge CEO Chris Cosby said that Bradley County's population to ER ratio is less than half the state's average, and that many residents were too far away from an emergency room.
It's not about miles, it's about minutes. As you heard, multiple EMS providers who got up here and spoke for us, that it's about minutes and getting access to an ER closer and faster.
Vitruvian CEO Lisa Lovelace said that they had made significant improvements to Bradley Medical Center since purchasing it in 2024. She said that the company is attempting to work around a current dispute with United Healthcare, which has impacted customers since August, by taking on the burden of the cost between out and in-network.
So the patient is paying the in-network amount and copays.
However, the commission did vote to approve Parkridge's application for free, giving residents who spoke up hope for Cleveland's medical future.
Equity means every part of this community deserves the same chance to survive an emergency. Right now, the reality is that the south side of Cleveland does not have that chance. This ER will finally put life-saving care where it needs to be.
Parkridge says with this approval, they expect to have this brand new freestanding ER open by 2028 at APD 40 and Blackburn Road. Reporting live, Nick Hill, News 12.